While we wait, maybe we can introduce ourselves in the chat so we all know who's on today's call.
Okay.
Do so myself.
Always nice to see the faces too. Thank you.
It is nice. It's nice to see some familiar faces.
Yeah, it is unmuted or muted up. Yeah, we're unmuted, but I would want to see the different look.
Put the chat on the side.
Yeah,
so
but how do I get it so that I have?
All right, well, I know it's 2 minutes past 1 on Eastern time, so I think we can get started. Welcome everyone again. Good afternoon or good morning, depending on where you're calling in from. I know we're a national coalition and we have folks calling in from all across the country. My name is Smeary Mackey. I am the project manager on the Moving Forward Coalition. I believe our chair, Alice Bonner, is joining us if she hasn't already. On this call. Thank you for tuning in to another one of our webinars, diving into each of the 9 action plans that we launched in late July. We had a little bit of a break since our last one. It's really great to see many familiar names and of course, welcome to anyone who's joining these calls for the first time. In today's webinar, we'll be learning more about the Strengthening Resident Councils Action Plan, why we want to build on best practices and how the coalition intends to develop and pilot a resource or guide to strengthening resident councils. And as I mentioned, I encourage you all to introduce yourself in the chat. I would love to see, and I know others would love to see who else is on the call. If you could chat in your name, your role, and where you're calling in from today. And I'm calling in from Boston, Massachusetts today. So what can you expect from today's call? At the beginning, I'll be sharing a little bit more about the coalition, about our action plans before I pass it off to Marie Painter and Anna Fisher, who will be sharing about their resident council action plan. And then we'll have some time for questions and discussion after their presentations. So please chat in your questions throughout the call, and we'll be wrapping it up with ways you can stay connected to the coalition. And of course, we do not want to forget thanking the John A. Hartford Foundation for funding the Moving Forward Coalition. This work truly could not happen without you and the support and guidance that you share with us. So who is the Moving Forward Coalition? Who are we? We are a diverse group of individuals and organizations who have come together, committed to drive specific and actionable improvement in nursing home quality. There are about 1,300 individuals, including residents, CNAs, advocates, nursing home providers, QI and QIOs, researchers from across the country in this coalition. And these individuals, I think many of whom it looks like are on this call, make this coalition a sustainable network to continue this vital work. The coalition's purpose is to develop, test, and promote the action plans to improve nursing home quality of care and life. And we're now doing this by taking the action plans that we published in July and beginning to implement those action plans step by step. So the coalition's vision and mission were really developed by and with many of you. Our vision is that every nursing home will be a community in which lives are nurtured, residents are empowered, and where people want to work. And our mission is really a means to that vision, that we will make vital change in policy and practice through the power of bringing diverse voices together. So how did these action plans come to be? And the action plans in the coalition really all started by looking at the recommendations in the April 2022 NASEM report, which focused on the importance of a holistic approach to nursing home quality improvement. I think many of you know that it is a very lengthy report, and our coalition came together with really the intent for this report not to just sit on a shelf, but for it to be really translated into actionable steps. So we took this report and identified which of the recommendations in this rather lengthy report could we prioritize as items that could be acted on and piloted on in the now. And in the end, the priorities that were identified had aspects of equity, sustainability, feasibility, collaboration. And this screenshot just kind of shows you the process of how we went through prioritizing some of the recommendations. So this is a screenshot from one of our many committee meetings developing the action plans, where we looked at emerging research, new partnerships, cross-committee collaboration, and of course, what matters to residents. And kind of continuing to build on all that work, we were able to publish these 9 action plans in July. And in today's call, we'll be learning a little bit more about the one at the bottom right here, Strengthening Resident Council's Action Plan, which I will actually chat in so we can, if you'd like to follow along as Mairead and Anna share a little bit more. And with that, I'm going to pass it off to you, Mairead and Anna.
Right.
It won't allow me to unmute. Can you hear me okay?
No, yeah, just
Sorry about that, everyone. Hello, I am Anna Fisher, and what a privilege to be here that we can discuss our efforts on the Resident Council Work Group. And we make further introductions here. Sumeri, could you please advance to the next slide? So again, my name is Anna Fisher. I am also a nurse. I am boots on the ground in our nursing communities and have such a passion for resident councils, and how privileged am I to be invited by our precious residents to actually participate in these resident council meetings. And also I want to highlight the importance. Co-presenting with me is Mairead Painter, and ombudsman, and I'm going to let her talk more about herself, but just the strength and the collaboration between the nursing homes and the ombudsman, they are our greatest ally. And Mairead, I'm going to go ahead, please introduce yourself and we'll continue the conversation.
Thank you, Anna. So I'm Mairead Painter. I'm the state long-term care ombudsman here in Connecticut. And to Anna's point, the ombudsmen are advocates for residents. We represent the residents' voice and ensuring that they have the information they need to be fully informed about their rights. We work with them when trying to support and educate the nursing homes related to things like how a resident council should function, the independence that residents should have when they're running their resident council, and to Anna's point, the fact that they invite her to their resident council because it is theirs. And that's something we really want to build upon. And one of the reasons that Anna and I felt so strongly about joining this group is having a partnership to show how resident councils can really improve. And we want to make sure that they are the residents' council and they represent the residents in that skilled nursing facility and represent their voice. Not the facility's voice, not the ombudsman's voice, but the people who live there and who that it really is supposed to represent. And that's what we're hoping to get from what we're working on here together. So back to you, Anna.
Thank you, Mairead. So our charge, as you see there on the left-hand side, strengthening resident councils, and really, what are we doing to amplify our residents' voices here? So the top line there, resident councils, it's a vital part of our community. We in long-term care, in our nursing facilities, we are already conducting these resident councils, but are we doing them as efficiently and as effectively as we should be? After all, again, the purpose is amplifying the resident's voice. So what are we doing here? More standard approaches and best practices. We're recognizing that they're needed to make sure that they can participate in these resident council meetings. After all, it's for them. And then the coalition will develop and test a guide for the nursing home teams, and we'll talk more about that, to establish and sustain engaging and inclusive resident council. This isn't to replace what we're already doing in nursing homes, but to help supplement and enhance what is already going on. We want to help support them to make it successful. Next slide, please. Our goal then to assemble that well-researched, a step-by-step resident council guide for the residents, the care staff, community members, and it will be pilot tested in at least 1 to 2 nursing homes. We wanted to make this manageable in our pilot testing. The resource guide then we use to assist the nursing homes to implement, sustain, and continually improve. We want it to be effective. We want it to be person-centered. This is resident-driven to amplify their voice. And Mairead, feel free to chime in at any time. So that was our main goal. Next slide. So our collaboration, and what a joy this process was. As our work group, we knew it was important to bring in the different vantage points and then harness the collective knowledge of all of these individuals. They have such passion to help us amplify the residents' voice and further strengthen the resident councils. What you see before you are some of the different individuals or stakeholder groups, if you will, residents, the family members, providers, ombudsmen, researchers. We put careful thought on our collaborative efforts. Mairead, any other group that we want to mention? I think we've covered most of them there.
We did. I just thought it was interesting in this collaboration. You think we all have the same idea about a resident council, how they run, but even talking to residents from different areas of the country, from different types of skilled nursing facilities, whether they were very rural or in cities, or the size of the skilled nursing facility really did impact how they felt the resident council ran and what information was given from one president to the next on the process, or who developed the process as to how the resident council ran. So it really helped us identify that we needed a standardized guide to help coach residents through how to begin this process and how to make sure that everyone had access to this information.
Thank you, Mairead. And importantly, as you see there on one of the items, when we were in the process of developing this guide and enhance our processes, we know it's resident driven, it needs to be, and provides the support, but education was key. To expect individuals to understand the resident council, what it is, the processes. We as a collaborative group identified the education was key here to making sure that we were implementing this, sustaining it as efficiently and effectively as possible. How do we ensure the resident voices are heard? You're going to hear that's almost that silver lining throughout our entire conversation. That's what unites us all. How do we work together to amplify the residents' voices? Next slide, please. So our progress to date, and we are excited to share our progress to date, aren't we, Mairead?
Absolutely.
So the coalition, we conducted a thorough literature review, an environmental scan, if you will, on it reports, existing tools, guides, best practices, everything and anything that was out there on how to run a nursing home resident council. And there was limited, what we discovered in our findings, limited. All the more reason to keep moving forward on what we're doing. So the work group, I really wanted to identify this. We also heard from experts with significant experience on how to run the resident family community advisory councils. And Dr. Michael Wasserman was instrumental on that, giving his feedback. And then from all of that, we developed an outline of our proposed timeline, which we're going to be sharing with you here in the next slide. And then engagement of the team members in alignment of all of our activities and involvement. Mairead, anything on here before I go to the next slide?
No, I would say the biggest thing for me was that engagement, making sure that we took the opportunity to ensure that all members of the team had equal opportunity to participate and to give as much time and to be as involved as they possibly could be.
Thank you. Next slide, please. So here's our timeline, and we're excited to go through this with you here. We are in September, but wanted to give you a little bit of a background on this. The group, the workbook, if you will, the resident council work group, that collaboration of key stakeholders here. As a group, we decided on a handbook, if you will, that we identified that we wanted to send out to solicit feedback from residents and from nursing homes. We wanted to gather their feedback, and September 8th was the deadline, if you will, to receive the feedback, and happy to report we received wonderful, meaningful feedback. Mairead, Chris, and myself, we're group members. We will be compiling this feedback that we received on this initial handbook. And once we compile the feedback, then we will give that to Sumeri, who's leading this call here. And then we will update that handbook, refine it, enhance it with any of the updates that we listen to what the residents said we needed to do to improve it, as well as the nursing homes as well. I'm going to pause there a minute. Mairead, anything you want to add on that before we move on the rest of the timeline?
No, I'll just point out that it does look like small groups, but we want to highlight that we are doing very small groups of testing and piloting, and then we will further test and pilot as we move out. But wanted to get that initial feedback because we aren't the experts, right? We wanted to make sure that the language, the way it was set up, the guidance, just get initial feedback from a few resident councils and individuals who would be using it so that we could put it out to other groups, and then we'll get further feedback as we move forward. But I know that's something that other people have brought up. Why just one or two? That's not going to be the limited scope. It will grow from there.
Yes. And thank you for emphasizing that again. We want that smaller group from the onset so we could better manage the process. This is all about soliciting purposeful and meaningful feedback. So then you'll see our next steps after Sumeri develops or enhances the guidebook with all the changes then. Then in November, we'll start conducting the nursing home recruitment for pilot testing. There you see, with a focus on nursing homes that may have struggled or challenged with resident council engagement or regulatory compliance. We're very sensitive to that. And then the pilot test proposed guide, and as Mairead was saying, in the 1 to 2 nursing homes, with the thought of expanding it to a larger sample size at a future date. Really want to emphasize that. Small to start, larger in moving forward in future endeavors. Okay. Anything else we need to add or say on this slide, Mairead? A very simple grid that showcases our efforts and our potential efforts thus far. Sumeri, next slide, please. Oh, was that a question? Or maybe I'm just hearing feedback. Okay, this is the equity slide. Sumeri, would you be able to help us with the chat as well? I just don't want to miss anything there either. So the equity, we spent a great deal of time talking about this, and Mairead will attest to that as well. Making sure that our efforts, that we addressed equity, the need for resident councils to be inclusive, respectful. We have the privilege of caring for some of the most vulnerable populations. And what are we doing to ensure the inclusivity, the equity, based on the unique needs of all. The coalition will identify the resources and guidance to support the residents experience a variety of cognitive impairments. Dementia is my specialty here in what I do, working boots on the ground in our memory care areas here. And so there are many different types of dementia. Let not that be an excuse for their active participation in resident councils. So being sensitive to that. And then I wanted, Mairead, if you could, to talk a little bit more about that last item there, because this is critical to ensuring we provide that support and the tracking of resident participation. Mairead?
Absolutely, thank you. So we really want to ensure that nursing homes are engaging all residents and really including individuals who may have historically been excluded from involvement or don't feel totally engaged in involvement. One of the things that we talked about, and Anna and I talked about, was having, for example, Pride Month in June. So we saw that some long-term care communities had Pride Month, but what are you doing every month or every week to include individuals in your community that are part of an LGBTQ plus group, and that not even a group, they're just part of your community, and so that they feel included and that it's truly authentic, not just that you're doing something in 1 month. I said that, we have church every week, but we also celebrate Christmas in facilities. And so even though you have something one time a year as a celebration, doesn't mean you don't honor it week to week and day to day for individuals. And that's what we wanted to talk about with this resident council booklet, ensuring that people had a voice, that it spoke to everyone, and that people felt that it was authentically represented the resident council for their individual skilled nursing facility. And that's what we're hoping that our guide produces and helps facilities do moving forward.
Thank you, Mairead. A great explanation of all that. It's just being sensitive to the many populations that we are privileged to care for. Sumeri, next slide, please. And so our partners, stakeholders, engagement, and our target dates as we move forward here. We identified the stakeholders that you see there: residents, family, care team members, providers, advocate, researchers, others. We put careful thought into these key stakeholders. The outreach and engagement, we are continuing to solicit feedback. Who else do we need to be including to partake in our efforts that will further strengthen our product and what we're trying to do here? And we're inviting small group sessions for their input. This has been highly productive, and thankful to Barbara Bowers and her resident council, her focus group, resident focus group that she has there. My goodness, the power of their voices. But we're very sensitive too that each of these key stakeholders, they have jobs. They're balancing their everyday workload with their volunteer efforts for the coalition. But we're all moved by the passion. You can tell in our voices. We're here, united we stand to move forward in really amplifying the residents' voices here. The collaboration has been exceptional with the different committee members. We continue to solicit their feedback. Their feedback alone strengthens what we continue to do. Mairead, you'll attest to that. Every time we talk, it's like, wow, why didn't we think of that? And then being sensitive and keeping in mind there to the timeline and the overall goals. We need to make sure it's practical. Are they achievable? Are they attainable? And are they time sensitive? Are they realistic? No better time than the present. And then keeping the residents at the center of our decision-making process and everything we do. I always say, here's that resident at the center that drives everything that we do, and how privileged we are to be participants with them. Next slide, please. How quick was that? So Mairead and I really wanted to thank you for allowing us to share our efforts with you here today. We are privileged to be part of the Moving Forward Coalition, proud to be advocates for our residents and help amplify their voices. And at this time, Sumeri, we're going to turn it back to you unless Mairead, did you have any parting comments?
Just thank you for having us today.
And Anna Marie, thank you for leading this work and for grounding us today in your action plan and really highlighting not how can we build something from scratch, but how can we build on what's out there to really promote strengthening resident councils. I do want us to move into our Q&A, but before that, if anyone from the resident council work group or anyone who's been engaged in the process have joined us, would you want to add anything? Right, I don't know if you saw anyone from your group.
There we go. We got Anna. I was going to try to unmute Alice.
I'm unmuted, I think so.
Oh, there we go.
I don't know if you can see the flag in the background, but I'm in the Hubert H. Humphrey building. We just had a really positive interaction and call with DMS. And the reason I'm mentioning it is Christiana Yao, who's senior policy advisor for the Office of the Administrator. When we went through all of the things, the overview of what the coalition's doing, we talked about residents, we talked about resident council, we talked about this call, and Christiana turned to me and said, you know, that voice, hearing the voice of residents is so important, and she just got it right away. So this is really central to our work. All of the action plans are important. Everybody's doing amazing work, but this is really, it's getting people who are passionate about this, like all of you, really engaged, and there's more work happening at the state level, at the regional level. And this is one of the action plans that has tremendous potential to really move forward, as we say. So I just want to say thank you to Mairead and Anna for their incredible leadership on this. It has not been a straight shot, that's for sure. But I think we've really, gotten to a very good place. And I know people are interested to see the guide, to see the draft of the guide, to give us, comments on it. So just wanted to really recognize them for all the work that they've done. Back to you, Samari.
Alice, and to that point, I know we have a question in the chat from Carolyn. If this draft guide is available for review, and Anna Marie, I was wondering, could we maybe engage Carolyn in future iterations of feedback collection?
I think I heard you ask, forgive me, it went out just for a moment. Did you ask if we could engage feedback? Oh,
right. And I know we're in our initial stages of gathering feedback on the guide, and I know we'll have many more iterations in the future. Perhaps we could engage Carolyn in those rounds.
yes.
If possible, Carolyn, could you send Samiri your contact information? I think
Yes.
we're starting to try to gather. I've had a few state ombudsman and regional ombudsman reach out, a few nursing homes. So if you know of a resident council, I see one of my resident council executive board team members on here. Hi, Jeanette. And we love feedback from, that's what we want to hear from, right? We want to hear from residents. We want to hear from care team members, individuals who actually are participating and using this information, because we can have all the ideas we want. It doesn't matter if it doesn't work well for them. So if you want to participate, we will try to, I think we're trying to engage as many people as possible. So if you can send it to Samiri so we can keep a running list, that would be really helpful to have in a central location.
We're flattered. Thank you. We want this feedback. It will only help us further strengthen what we're already doing.
And I'll just add that Carolyn and I met at the AMDA conference last fall, and she participated with us in some of the networking. She works for iPro or with iPro, so she's part of the QIO in New York State, and she does a lot of work in New York, so she brings that whole perspective. So Carolyn, I don't know if you want to speak up and say anything, but we're delighted that you can do a little bit more with us on this specifically. It's wonderful.
You would just make my week, month, year to allow me to participate in the review of this. This is a topic that's near and dear to my heart. I have a 92-year-old mom who's active in her own facility, and this is work that we try to embed in all of the work that we're doing with both the iPro and the Alliant QIOs to engage. It's all about what matters most, that go concordant care. And I'm quoting this work in a lot of the stuff I'm doing. So yes, use and abuse me, Alice.
We
No,
will,
and
don't worry.
That's wonderful. Thank
It's
you.
my
for
favorite
sharing.
action plan of all of them, really.
Give a plug there for family councils too. You said you're a family
Yes.
member. Let's get some good family councils going as well. And hopefully we can use this as a model for that.
And you know what we're working on, Maureen and I were chatting about this earlier, is we cannot expect individuals to know how to launch successfully, implement a resident council. There's a process to it. And so that's what we're trying to do. What can we do to help support? People need this guidance to help them make it successful. And once you have it going, how do you sustain it successfully? Therein lies the challenge, especially being boots on the ground. I mean, wow. So whatever we can do to further strengthen. So yes, if there are others that would like to have a review, we welcome your feedback. Sumiri, would it be best just to have them reach out to you then? And then you let us know to connect, or?
I'm gonna chat in my email to anyone who may want to reach out and share
Okay.
their contact information, but I love the connection we've just made here.
Mhm.
I think
Yeah.
building in that sustainability is key, because every building's culture I'm an administrator by background, shifts as leadership changes. You have people, very active residents that are leading the council, and something maybe happens to their health and they're not as involved. All those dynamics just impact the sustainability. So I think anything we can do to really build that and make that part of the culture that's not impacted by some of that ebb and flow, I think is just really transformative work.
And I really, this conversation about sustainability is really important. Sometimes we have to remind ourselves. Every day I wake up in the morning and I say, we're in year 2. We have to remember we've accomplished a whole lot in year 1. We have to remind ourselves of that. But the value of being in year 2 is it is the right time to start thinking about the sustainability and figure out, in the face of all of the challenges, the staffing challenges, the regulatory challenges, all of that, we have to still say to ourselves, okay, so that's what we have. That's where we are right now. What are we going to do? What can we do? And there's a lot we can do. And I think part of what makes this work group so good at what they do is, they are always asking, how can we do this in ways that minimize the burden on the nursing home team? Who else can run a resident council? I remember these conversations. Can it be somebody from the community? It has to go through the residents. The residents have to decide. But could it be, what are the options that might work? So we do need to think about, limited CNAs, limited nurses, social workers, et cetera. But, how can we get it to work? And this is part of public health. It is part of the community. So how do we promote that? Again, Mairead has done unbelievable work in Connecticut with resident councils across the state, and other ombudsman programs have done similar things. So it's possible. We know it. We've seen it. How do we get that, in more places?
Thank you. And I see Liz leaving. Goodbye, Liz. And Jeanette is on, who is from our executive board of presidents of resident council. And sustainability is huge. One of the things that we've heard, to Carolyn's points, one thing I'll say is we have more new administrators, directors of nursing, rec directors, social workers, at least here in Connecticut, than we've ever seen before. And they want to do a good job. This is one component of the work that they do that maybe they didn't get a huge education piece on. And how do they know what to do? And how are they ensuring that the way that they're moving forward with their residents is appropriate? And so this would be one way of us helping to coach them through. And the same way with the residents and providing that education and support for them. We find it really helpful. Jeanette is on. We have a booklet that we hand out that we give to all of the residents and our resident councils. I don't know, Jeanette, you can take it from there.
I'm sorry, Mary, I heard background noise. Were you talking to me?
I said, you can talk a little bit about our booklet that we give to resident council presidents and stuff about needing to help people understand it's the residents council, but we want people to be able to share their best practices and be proud of where they live and what's happening in their communities.
Right. It's we've started out doing this with the e-board as new e-board members come on. It gives them a little bit more background of what the expectation is from the person working in the group, some of the accomplishments that have already been done through the group. So They recognize that the voice of the resident can make a difference. For instance, the P&A raising, I put 7 years of my life into getting that passed and was just still overwhelmed and joyed that we made that much of a difference in I want to say a short amount of time, because as you all know, many of us have been doing this for decades, or it seems that way. I think it's very helpful for somebody to have something in hand to be able to look at their leisure, but also have a guide in seeing how others have done it so that they can either do it as well or give examples of how to improve it and make it better, and really bring it into the area and time frame that you're living now.
And Jeanette, you bring up a good point. We're all different learners, and having that tangible handbook, look how beneficial that is.
Yes.
Our residents, yes, are the same way. Thank you, for that.
Some people are very verbal and they can get it verbally, but I myself need to have it in print to be able to look at it, read it, kind of experience it through that way. And that way I'm able to pass it on better. And I know other people learn that way as well. So.
Lynn, I see you have your hand raised.
Yep. Hi, I'm Lynn Swisher, and I'm on the targeted survey action plan work group. Your work is really exciting, and one of the nice things about what we all are doing is the partnerships as we move forward multiple things. And when our group is looking at improving the survey process, clearly one of the best parts about that is the focus on it being truly resident driven, and our work I see would dovetail very nicely with the resident council work, because we looking at how do we design mechanisms for resident driven surveys and surveyor interaction as they identify issues, and they clearly, one source would be the resident council. And if the state surveyors during the annual survey process can identify those key areas, then that could trigger then how the survey would go, looking at that issue that was brought up at the resident council, making it truly a resident driven survey process. So exciting possibilities, and thank you for letting me sit in on your meeting here, and hopefully we'll take these things back to our targeted survey group, and we'll keep you posted on our work too.
Can I comment on that? Can I comment on that? One thing I would suggest with the surveying part is that really make sure the surveyor takes enough time with a resident, that it's not just an in 2-3 minutes, oh, how's this going for you, blah, blah, blah. They need to set aside specific time for some individuals specifically, because it takes them a few minutes to warm up and trust someone to be able to tell them some of the issues they're struggling with. And you're only getting the cream at the top. You're not getting the real root of the situation if there's not enough time given for the resident to actually share what they're feeling and thinking. Can't be a hit or miss.
Thank you.
Feedback.
Thanks, Jeanette.
Yeah.
Jeanette always has.
Go ahead, Marie.
Thank you, Mary.
Did I cut you off, Marie?
No, I just said Jeanette always has great feedback for us. And I just wanted to say the e-board that she's talking about is here in Connecticut, we have something called an executive board of presidents of resident councils. So from every region of the state, we have a representative that represents that region, and they advise my office on issues, concerns, legislation. And so they meet twice a month, and then they get to tell me what to do.
Well, we hold your hand, work with you.
Yeah, that's such a great example, right? Of, within a state, great strong leadership from Mairead and from Jeanette and others, and, pulling it all together across the state in a way that really works. And, there's real stuff happening, proposing legislation, updating regulations. it doesn't go through the first time. We know that, but that's okay. We're out there. You are out there doing that work, and we want to replicate those things in states that don't have a statewide, system or process. We have to get out in front of people. We need to get in front of legislators, state legislators, other people. Every single opportunity. The mayors, the town councils. And it's got to be you guys doing that, because the Moving Forward Coalition as an organization, we're not allowed to lobby on particular pieces of legislation, but you guys can. So, we really do depend on this.
Again, thank you, Lynn and Jeanette, for sharing, and I really appreciate the cross-committee collaboration. I think this is what we want to see. If you want to correct me, Alice, this is what we want to see, because at the end of the day, the action plans are meant to be a set to improve nursing home residents' quality of life and quality of care. Mairead and Anna, I just wanted to flag for you that Julie in the chat also offered to share feedback on the guide when we do that second round of feedback collection. And I see your chat, Anna. There we go.
Yes, and again, Sumiri, thank you for that. We appreciate anyone's feedback, involvement. We learn from you all, we really do. And I'm so thankful for the time and you all joining us today. Are there other questions?
Just as think about your communities at large, we really want to ensure that we are getting a diverse sample. So I want to know about every different type of nursing home, big, small, every different makeup possible, to ensure that when we're testing this and we're getting feedback, we're getting it from everyone.
For-profit, non-profit, rural, urban. Yes, we've been very sensitive to that. Great points, Mairead.
And if anyone would like to be unmuted, please feel free to let me know in the chat. Well, if we didn't have any other questions, I think we can wrap up. Anna Mairead, I'd love to share a little bit more about how everyone can stay engaged in the coalition. And of course, as Anna Mairead mentioned, if you would like to share feedback, or anyone else may want to share feedback of the Resident Council Guide, please reach out to us, and I can chat in our email in the chat again. So how to stay engaged in the coalition, in the action plans. I think most people have seen the action plans by now, but if you haven't yet, please do consider how your organizations beyond this action plan could get involved in each action plan. We really outline needed partners and resources, and if you're interested in collaborating, again, please do email us to stay in the know of our coalition's latest progress. And upcoming events like this and other webinars. Do join our newsletter and do follow us on LinkedIn. And lastly, we'll have 2 more coalition conversations, webinars just like these. We'll do a deep dive into the action plans. The one that's coming up next week on September 20th is on expanding CNA career pathways and improving CNA wages. And then we'll have our last coalition conversation of the action plans on the HIT readiness guide. And the recording of this webinar will be sent out shortly. Thank you all. Thank you, Anna Mairead. Alice, would you add anything?
I was just going to ask if Jane Carmody, from the John A. Hartford Foundation, had any thoughts from her perspective. I know they have a board meeting today, and she's always listening closely on these calls. Jane, do you have anything you'd like to add?
Thank you, Alice. What a perfect timing for this call. As Alice mentioned, our board asked that we report back on grants every so often, and in this case, it'll be a full year since this work has been going on, and so much has been done. And this has been such a great I would say, I know we don't want to say any action is the most important, but this is really very important. And I know Alice brags about the work that Anna and Marie are doing, and we so appreciate it. I can't tell you how much the foundation appreciated. Our only goal and mission is to improve the care of older adults, and this definitely is that. And I have to ask you a quick question. Are you from Nebraska?
I am.
So there you go. Hillcrest is well known to me. I worked and lived in Omaha most of my career.
Oh
And,
my gosh.
Hillcrest, I would just tell you, Alice and team, Hillcrest is well known for its
Mhm.
quality, for the attention to residents.
That's Anna. That's Anna for
And
sure.
there you go. It was developed and started by a social worker. Is that right?
That
Yeah.
is correct.
And it's grown quite a bit now. And I was just looking you up. I thought it's gotta be Nebraska. And anyway, Alice, it was wonderful here. And I will tell you a quick story. I said to my granddaughter, we're going to go to Nebraska in May for a wedding, and I'm going to see if you can go with us. And she said, do you need a passport to go to Nebraska? Open like a true New Yorker, right?
Yeah.
But anyway, Anna, thank you so much. Marie, thank you so much. And hopefully more to come on helping you get this work started and up and running.
Our pleasure.
Fantastic. Love the connections. Love the Nebraska connections.
Absolutely.
Kate, I just want to say, Mary, Kate chatted in. She's an advocate in a New Jersey nursing home, and we love increasing the advocates who work with us. We need to do more of that. So, Kate, if you want to chat in your email or send it to me or Sumeri, we'll reach back out. Oh, fantastic. Okay, thank you so much. We'll reach back out. We'll connect with you. That's terrific.
And New Jersey is one of the ombudsman states that had reached out and said that they were hoping their buildings, they had some buildings they were hoping would get involved. So that's great.
That's awesome.
Thank you all so much for joining us again. Another big thank you to Marie and Anna. Thank you, and hope to see you in future calls.
And thank you to Sumeri, who leads these
Yes.
calls every time. Thank you, Sumeri.
And
Thanks.
Alice.
Participate.
Thank you.
I tag along. I'm
Yeah.
just, I'm here for the background. Thanks,
Thank you all for
everybody.
participating.
Yes.
Have a great.
Great. Always. Thank you.
Thank you, Anna. Thanks, Mary. She's off. Bye, Jeanette.
Bye, Marie.
Bye.
Enjoy your
Everybody.
business.
Bye.